Hi, everyone. Dr. Hess here with a quick overview of Chapter 8. We'll be talking about schizophrenia and some of the psychotic disorders, emphasis on schizophrenia. Again, we're delving into our textbook, and our textbook takes a lot of our material from the DSM-5. And so if you're interested in that, the DSM-5 is easy to Google and bring up. A lot of information for you right there. So let me bring up our share here for our chapter work, and we'll talk about schizophrenia a little bit. Let's see here. Psychosis is the main symptom of schizophrenia and the psychotic disorders. And psychosis is the inability to differentiate between reality and non-reality, or what's there and what's not there. These come in two different flavors, symptom flavors in these things. It's the negative and positive symptoms. Negative, positive are not good and bad. They are negative, meaning they are removing things that we normally have as people, and positive means we're adding things that we don't usually have as people. So it's how we lose touch with reality. Delusions are these thoughts that aren't true. They are a positive symptom of schizophrenia and psychosis. These can be a lot of different types of delusions, which are here on the screen right now. Thoughts of being persecuted, being followed by the government, people are listening to you through the TV, delusions of guilt and or sin, that you somehow offended God, and this is causing you not to be able to function in your daily life because of this. Hallucinations are perceptions. And if you remember back to our introduction course of Introduction to Psychology, we spend a lot of time talking about our senses, our ears, our smelling, our taste, our touch, our vision. And this is because we can have dysfunctions in all of our senses, and some of these dysfunctions can be hallucinations. We are seeing things that aren't there. We are hearing things that aren't there. We're smelling things that aren't there. We are feeling things that aren't there, and this positive symptom can be very disturbing to people. Causing one of the other symptoms of schizophrenia, which is kind of this disorganized, unpredictable behavior that goes along with the thought processes and the hallucinations. There is a restriction in emotion that most people with schizophrenia experience. They have a kind of a narrowed emotional expression. They have cognitive issues. They have a hard time concentrating and making new memories or learning because of all of the things that are going on in their mind through the dysfunction of their disorder. Let's keep going here. Most people are going to be hospitalized at one point or another for their schizophrenia. They will then be medicated, and oftentimes will then be released to a halfway house or kind of outpatient treatment. Here's some of the other ones. What are the theories behind it, or why do people have these disorders? Of course, there's the genetic problem that somehow that it seems that schizophrenia runs in families, and so we have an increased predisposition to schizophrenia if we have a sibling or a parent that has this thing. We also see the increased size in the ventricles of people who have schizophrenia. The ventricles are those spaces inside the brain that are filled with fluid. And for some reason, people with schizophrenia have larger ventricles. Let's see here, some of the different things we have. Do keep going. So what are some of the treatments? So the treatments are antipsychotics, so non-psychotics, things that help alleviate or lessen the psychotic positive and negative symptoms, mainly trying to control the delusions and the hallucinations. Some of these early antipsychotics had really severe side effects, but were used because they did help the people be able to leave hospital. Some of those side effects continued after the medication was removed from the person. So they have changed now to some of the newer, more modern ones with less side effects. Thank goodness. All right, let's see here. Family therapy and kind of group therapy is important in schizophrenia. Family therapy, because it's important that the family kind of has a little psychoeducation about the disorder, helping everyone support their family member who is suffering or experiencing schizophrenia. Again, community treatment and day treatment is important for a lot of people who are dealing with this and helping to manage their disorder. Well, let's keep going. And there we are. That was a very quick overview. Thank you for listening. Dr. Hess there saying, I will see you next time.